Well, shifting now to the latest in the historic nationwide vaccination rollout, the CDC says the federal government has sent out more than 22 million doses of the vaccine. 6.6 million of those doses have been administered. Experts say roughly 280 million Americans will need to be vaccinated in order for the U.S. to reach herd immunity. Well, that 6.6 million figure well below the Trump administration's goal of 20 million vaccinations by the start of 2021. For months now, state health officials have warned that they did not have the financial nor logistical support to quickly administer the vaccine, chiefly criticizing the lack of a national strategy from the federal government. So joining us tonight on News Nation to discuss the challenges associated with the nationwide vaccine rollout is Dr. George Diaz. He is Chief of Infectious Diseases at Providence Regional Medical Center Everett and former Chief Medical Resident at the University of Utah. Dr. Diaz, thank you so much for joining us tonight.
Thank you for having me, Nicole.
Well, as we just said, the U.S. dramatically behind that stated distribution goal for the end of 2020. How do you think we can speed this up?
It's a big problem, and there's a lot of reports about complaints about the federal government that are actually well placed. The federal government, I think, believes that it's basically just Amazon delivering the vaccine to the states and expects the states to do everything to get the vaccinations into people. Unfortunately, this is a complex process, and it's not that easy. They basically, there's no national strategy here. The federal government really did not provide the educational component for people to receive the vaccine. So there is a huge amount of disinformation about the vaccine, many rumors about side effects, and people are quite hesitant to receive the vaccine because of these disinformation campaigns. That makes the job on the ground much harder to convince people to get their vaccinations. The delivery of the vaccine has also been quite uneven. Many states received far less vaccine initially than they had been advised they'd be receiving, which makes it very hard for the local health departments to plan with hospitals and health systems to vaccinate people when you don't really know how much you're getting. And then also the resources required to actually vaccinate patients is also complex because this vaccine, the Pfizer vaccine, for example, requires refrigeration at minus 70 degrees. And there's only a limited number of hospitals that have that capability to store vaccine that way. And also you have to observe patients for 15 minutes after the vaccination, which means that each vaccine administration takes a bit longer than, for example, the flu vaccine. So all of these issues have come to a head and made it very difficult for public health and health systems to vaccinate patients.
Well, absolutely. Dr. Diaz, we know there's been some talk of delaying that second dose of the vaccine to try to further increase the number of people who receive the first shot. What are your thoughts on this as maybe a possible solution to the slow rollout?
Yeah, within our health system, we really don't want to see unused vaccine. When we thaw the vaccine, we really need to use it to be able to not have it go to waste. And so we've begun, vaccinating all of our caregivers within our health system, whether they're frontline or administrative staff or in IT, for example. We think that getting the vaccine into as many people as possible is the way to go. And so we've really focused on getting as many people as humanly possible vaccinated. And we expect to be able to give them the second doses on time at this point.
So you don't think possibly giving, holding off on that second dose to give more people that first dose, would there be any concerns then with extending the amount of time between getting that first and second dose?
We're trying to comply with the limited guidelines that have been provided to us. And as Dr. Fauci had mentioned, really we would like people to stay on their appropriate schedule, but we are opening up the vaccines internally as much as we can. So, at this point, we are having even some, like, for example, nurses not receive the vaccine. So there is what appears to be plenty of vaccine, at least for healthcare workers, available to vaccinate as many people as possible. And at this point, we're not planning on altering the timeline for the second dose.
All right, doctor, that definitely makes sense. And back to the distribution, many people see the slow distribution process for this COVID vaccine compared to the distribution of the regular flu shot. I know you touched on this a bit earlier, but kind of explain why the approach really has to be different.
Yeah, so the observation period for a COVID vaccine is generally 15 minutes, and if someone has had issues with any vaccine in the past, oftentimes they have to be observed for 30 minutes, and so that substantially increases the operational time in clinics, for example, to administer the vaccine because the patients have to stick around and be observed, as opposed to the influenza vaccine, which can be given and the patients can just simply leave. We're being very careful monitoring for side effects. We know there are side effects that are generally mild, but based on current guidelines, we're following them very closely for observation after the injection. And that primarily really affects the throughput of the vaccine.
And Dr. Diaz, this may not be an issue, but do you think the rollout process will be impacted at all as people start returning to facilities to get that second dose, as so many others are also there to get their first?
Yeah, and I think that many of the public health counties are working on, mass vaccination programs. I know in King County here in Seattle, they are planning large mass vaccination clinics that are going to be vaccinating up to 16,000 people per day. So, there are creative ways that public health are working on getting this vaccine out as fast as possible.
All right, Dr. George Diaz, Chief of Infectious Diseases at Providence Regional Medical Center, Everett. We thank you so much for your time tonight.
Thank you.